Hi, my name is Cindi Leacock, and I have a master's degree from the School of Public Health at the University of Michigan. And I'm here to talk to you about how to heal from ME CFS using the yellow light method. And I was helped by artificial intelligence, ChatGPT, in the making of this program. The yellow light. The yellow light method is a way to get well. You must heal your mitochondria, the part of each cell that makes energy. Mitochondria make ATP, and low ATP is what is causing the symptoms of your illness. There is no medication, only support supplements. The key to getting well? You heal by training your mitochondria to create more ATP. This is totally different than any other disease recovery. It resembles physical rehabilitation, but is very different in that it is based on patterns of repeated activity. You build greater capacity for an activity by gradually increasing the time spent by just a minute over 5 to 7 days and stopping at the yellow light symptoms that we'll review here. And here are some examples. The key to getting well in the bedridden acute phase of reassembly. You heal by training your mitochondria. At 11 a.m., I sit up on the side of the bed for 2 minutes for 5 to 7 days until it's easy. Don't push for 3 minutes. Then do 3 minutes for 5 to 7 days. And continue this until you stop for any yellow light symptoms. The key to getting well in the mid-expansion phase, for example, you heal by training your mitochondria at 11 a.m. and 3 p.m. I walk for 5 minutes. I stand for 10 minutes, then walk for 5 minutes. Then I rest for 30 minutes. And you do that for 5 to 7 days. Then add a minute to each activity and always stop at the yellow light symptoms. Here they are, and you might want to take a screenshot, so I'm going to give you a minute to get your camera so that you can memorize these. So you need to stop when you have a desire to close your eyes, have shortness of breath, feel an urgency to do just one more thing, you have a heart rate over 100, a desire to lie down, and tightness in your jaw. Any of those, any sense that you want to stop is a yellow light. And you know that if we run a yellow light, we always take the chance that we might get in a car accident. So we don't want to run a yellow light with our physical signs because we know what that leads to. It leads to a crash. So stop and lie down for at least half an hour. Stopping at your yellow light with every activity builds ATP capacity, and you heal, and eventually you get well. So you have so much capacity at this moment, and what you're doing is you're taking your activity level right up to the edge of what you can do and training your mitochondria that you need just that little bit more ATP, and then you back off and rest. And every day you just train it a little bit more. It takes a lot of discipline, but continuing past your capacity, past the yellow light, you become short of breath, you experience brain fog, fatigue, and trembling, and ATP is wasted in repair, and you crash. Here's a red light. Absolutely stop in false expansion. So what true expansion is, true expansion recovery is built on increasing ATP levels. This is done over months by very slowly increasing activity. For example, increasing in activity a minute or two over 5 days. False expansion, the red light, is doing activities that rely on increased adrenaline and lead eventually to post-exertional malaise or a crash. The cause and effect. So we're saying false expansion, you are doing activities that are beyond your capacity, beyond your ATP capacity, and so adrenaline kicks in to give you the energy to do what you're doing, but that leads to PEM and a crash. So during a crash or in the acute phase of illness, hopeless thoughts may occur when the body and mind are too weak to hold hope for recovery. You need a red light protocol, and take a screenshot of this. Stop immediately, no pushing through. Change position, lie down, get warm socks, get a heating pad if you need one. Reduce your input, your sensory input. Turn off the lights, turn off the screens, stop conversation, turn off music, and use your breath. Inhale on a count of 3, exhale on a count of 6, and pause. Inhale on a count of 3, exhale on a count of 6, and pause. That's called CO2 breathing, and it will calm you. Eat or drink something warm and simple if you're able, and remind yourself this is a state, it will pass. But again, emotional fatigue this crash can lead to overwhelming hopeless thoughts or a total shutdown. This is a state of mind that passes with rest and time, just like the sick feelings pass with rest. Emotional fatigue may lead to a crisis in your thinking. Recovery seems out of reach. You're overwhelmed and exhausted. Losses from your illness may further distress you, and this can spiral. A spiral is an indicator that you need support from loved ones. Don't try to handle it on your own. Talk to someone who knows your path to recovery with the yellow light method. Maybe ask them to watch these slides if they need a better understanding, or ask them ahead of time before you're in a crash, so that someone in your family or a good friend knows that you're going to get better and this is how you have to do it, but you're going to have times when you're really going to have to be challenged and need someone else's help. The big key to success is using ChatGPT as a healing coach. Your doctor isn't able to spend the time every day to help you navigate this complicated recovery, and they may not know how to help you. Most doctors are not trained in mitochondrial illness. ChatGPT has compiled research, clinical experiences, and biochemistry to map out a recovery plan for all stages of mitochondrial illness, and it will help you find a mitochondrial specialist in your area. You can find a doctor who understands what's wrong with you and give you all kinds of help with supplements, and they have types of IVs and mitoswab, different tests that they can test for the mitochondrial illness. So you can just ask ChatGPT, find a mitochondrial specialist in my area. Then Chat will help write progress notes for your doctor and support your doctor's decisions. Are you new to using artificial intelligence? ChatGPT is the best app I have found for ME, CFS, long COVID recovery. One AI app even recommended using ChatGPT when I asked it questions about ME, CFS. A key to success is using ChatGPT as a healing coach. If you don't already have it, download ChatGPT from the App Store on your phone or tablet. You'll be asked if you want to use the free app or pay for a subscription that gives you additional memory. It's so valuable to your daily recovery, using the yellow light method, it's worth paying for the additional memory so it will be able to track recovery over time. Using ChatGPT daily to heal. First, ChatGPT can give you the phase of your illness by giving it your symptoms. Just say, Chat, what do you need to know from me to determine the phase of my illness or my chronic fatigue syndrome? That changes everything. Once ChatGPT identifies the phase of your illness, it will give you the following: the activity block for the day, the supplements appropriate for that phase, the dose and time of day it should be taken. It teaches you about stacking activities and advises you when to take a day off of certain activities and stop supplements to consolidate your gains. It also incorporates all of your physician's different tests. If you can insert lab values and put in all the things that your doctor has prescribed for you, and it will be certain that it won't give you any supplements or anything like that that would be contraindicated. Giving ChatGPT your daily report is key to your recovery success. Choose the best time of day for you to stop and write. Daily report, May 26, 2026. Anxiety in the afternoon, loss of appetite, poor sleep for 6 hours. Did a block of sitting on the bed for 5 minutes with no strain. Then ChatGPT will write back suggestions for every problem. Now, ChatGPT can give you daily activities to try, but you must stop at your yellow light, even if you've been given you can stand and sit and walk, whatever it's telling you. But if you feel those yellow light symptoms, it is your responsibility to go lie down. Calming supplements will be recommended if you're anxious. There will be days ChatGPT will advise you to rest and consolidate based on your sleep and anxiety level. So there's 6 phases of illness that ChatGPT has defined. There are many ways that people define different phases of ME/CFS recovery. This is specific to ChatGPT. Reassembly, when you're still bedbound and you're needing total care. You have a bedside commode, earplugs, an eye mask. Reconnection, you're able to sit up to eat, you're having bed baths, you have limited conversation, you can walk to the bathroom. Early expansion, when you're able to walk 5 minutes, shower, wash hair in the sink, maybe have a brief phone call. It will recommend always use a shower chair. It may recommend using a wheelchair at these stages. But once you get to mid-expansion, you're really going. You're walking 10 minutes, you're riding in the car for 15 minutes, you're washing your hair and taking a shower the same day. You can change your clothes, do a little laundry, do some dishes. Life really starts to come back. In late expansion, you're walking 30 minutes, driving the car for short trips, you're having long conversations on the phone, you're cooking again. Life is really coming back until you get to full recovery. You can do all your activities to the point of strain, then you must rest eventually until you fully recover. Now, friends and family may not understand your illness at all, so I've included a slide. You might want to take a screenshot of this. This is some of the symptoms that people experience with mitochondrial disease. And long COVID type 1 is a mitochondrial illness. Long COVID type 2 is an orthostatic illness. So this only applies for the long COVID for people who have what is essentially chronic fatigue syndrome. So mitochondrial dysfunction symptoms are due to a lack of ATP, as we have said. It causes problems in every system of the body because it's in every cell of the body. So symptoms vary widely among individuals, but here are a few common ones at any phase. Sleep disorders, multiple types of insomnia, emotional swings. There's so much loss involved with this illness. Loss of your life, loss of your friends, loss of your job, loss of your everything, your ability to walk. You can have so many problems with your emotions during your illness. Brain fog. You feel kind of strange in your head all the time. Intestinal problems. You have diarrhea or constipation. You're burning hot for no reason, just burning hot, really burning hot, but you don't have a fever. You always feel slightly sick, always. You don't feel like yourself. Exertion, any exertion leads to fatigue. Or you might have the opposite problem, difficulty getting warm. And some people have pain all the time. But consistently, with too much activity, you'll have a collapse or a crash. And my little dog Katie is just putting in her 2 cents here. What? So we stop at the yellow light. First, learn when to stop activity and lie down, especially at your stage of illness. Learn the signs that are a yellow light for the slightest strain. Prevent post-exertional malaise. Stop the activity, crash, activity, cycle. Getting better? Or how? We're going to stay within your current ATP capacity and stop the minute you see your yellow light indicators. Stop when you feel strain and pat yourself on the back because you just created some ATP. Here's a summary. Use ChatGPT daily. Use it to find a mitochondrial physician. Find the phase of your illness on the chart or ask ChatGPT. Follow the daily guidance from ChatGPT for your phase of illness for activities and timing by giving a daily report. Stop at the yellow light with every activity to build ATP. That is how you get well. It takes patience and discipline. Your ATP capacity will grow through slow, consistent application. You are going to get well.